Definition of pediatrics. Pediatrics is a branch of medical science dealing with the health, development, and diseases of infants, children, and adolescents. Derived from Greek words pi, child, iatros, healer, physician. Adrosh. Goals of pediatric. 1. Promotive care, ensure optimal growth and development. Regular health checkups, early detection of potential health issues. 2. Preventive care, vaccination programs and health education. 3. Curative care, diagnosis and treatment of illnesses in children. 4. Rehabilitative care, for children with physical or mental disabilities. 1. Neonatology, care for newborns, including preterm and critically ill infants. Immediate care after birth, e.g. APGAR scoring. 2. Developmental pediatrics, monitoring growth milestones, physical, cognitive, and social. Identifying developmental delays, speech, motor skills. 3. Preventive pediatrics, immunizations, nutritional counseling for malnutrition and deficiencies. 4. Behavioral pediatrics, managing psychological issues like ADHD and autism. Adolescent medicine, focus on puberty, mental health, and substance abuse. Importance of pediatrics, physiological differences. Children have immature organ systems and different metabolic rates compared to adults. Disease patterns. Specific conditions like congenital anomalies, genetic disorders, and infections are more common in children. Preventive potential. Many illnesses can be avoided through timely vaccinations and health interventions. Principles of pediatric nursing. 1. Family-centered care. Involve parents in decision-making. Respect cultural and individual family values. 2. Holistic approach. Address physical, emotional, and social needs. 3. Age-appropriate communication. Use play therapy and simple language to explain procedures to children. 4. Advocacy for child rights. Promote the right to education, nutrition, and healthcare. Developmental milestones. Overview. 1. Motor development, head control, 2 to 4 months, crawling, 6 to 9 months, walking, 12 months. 2. Cognitive development, recognizing faces, 2 months, object permanence, 6 to 9 months. 3. Smiling, 6 weeks, stranger anxiety, 9 months. A national preventive pediatrics. 1. Immunization schedule. India's National Immunization Program, BCG, OPV, DPT, hepatitis B. 2. Nutrition counseling, exclusive breastfeeding for the first 6 months, addressing common deficiencies, iron, iodine, vitamin D. Challenges in pediatrics, communication barriers with younger children, parental anxiety and overprotectiveness, managing chronic illnesses like asthma or epilepsy. Key terms to remember. 1. APGAR score, a quick test to evaluate newborn health. 2. Growth chart, a tool for tracking physical development. 3. Congenital anomaly, a defect present at birth. Today, we're diving into the goals of pediatrics, a foundational concept in child healthcare. Pediatrics is not just about treating sick children. It's about ensuring their overall well-being through a multifaceted approach. Let's break this down into 4 primary goals: promotive care, preventive care, curative care, and rehabilitative care. We'll explore these in detail using real-life examples, practical applications, and simple terms to help you understand how they interconnect and why they're so crucial. 1. Promotive care. What is promotive care? Promotive care focuses on creating an environment that supports the optimal physical, mental, and emotional growth of children. This isn't about treating diseases, but rather about boosting health and ensuring that children thrive. Key aspects of promotive care. 1. Growth monitoring. We track the child's height, weight, and head circumference during routine checkups. Tools like growth charts help us compare these measurements with standard benchmarks. If a child isn't growing as expected, we can catch it early and take action. Example, a 6-month-old baby's weight is checked and found to be below the growth chart percentile. The pediatrician advises on increasing calorie intake. 2. Developmental monitoring. We look at milestones like walking, talking, or waving goodbye. If a baby isn't meeting milestones like sitting by 8 months, it could indicate a developmental delay. Example, a child who doesn't start speaking by 2 years might need further evaluation for speech therapy. 3. Health education for parents and guardians. Parents are the child's first caregivers. We guide them on topics like nutrition, exclusive breastfeeding for the first 6 months, proper hand washing to prevent infections, safety, using car seats or covering sharp edges in the home. 4. Psychological and social well being. Activities that encourage self esteem and social interaction are promoted. Example, encouraging a shy child to join group activities to build confidence. 2. Preventive care. What is preventive care? Preventive care is all about stopping diseases before they occur. Think of it as taking steps today to avoid big problems tomorrow. Key aspects of preventive care. 1. Immunization programs. Vaccines protect children from dangerous diseases like polio and measles. Pediatricians ensure timely vaccination according to the National Immunization Schedule. Example, a 9-month-old child gets the measles vaccine to build immunity. 2. Nutritional interventions. Addressing malnutrition is a key part of prevention. Example, teaching families to include iron-rich foods like spinach in their child's diet to prevent anemia. 3. Screening programs. Routine checks help identify hidden problems early. Example, a newborn screening test detects hypothyroidism, preventing complications later in life. 4. Health education. Educating families about preventing common issues like diarrhea. Encourage ORS, oral rehydration solution, during episodes. Mosquito-borne diseases. Use mosquito nets and repellents to prevent malaria or dengue. 3. Curative care. What is curative care? Curative care involves diagnosing and treating illnesses in children. This is what most people think of when they imagine visiting a doctor. Key aspects of curative care. 1. Management of acute illnesses. Conditions like fever, diarrhea, or respiratory infections are treated with medication and supportive care. Example, a child with a high fever is given paracetamol and hydration advice. 2. Management of chronic conditions. Long-term care for issues like asthma or epilepsy is provided. Example, a child with asthma gets regular checkups, inhalers, and a plan for emergencies. 3. Emergency care. Immediate help is given for conditions like poisoning, severe dehydration, or febrile seizures. ABC approach, airway, breathing, circulation, is used in emergencies. 4. Individualized care plans. No two children are the same. Plans are tailored to the child's specific needs. Example, a diabetic child gets a customized diet plan and insulin therapy. 4. Rehabilitative care. What is rehabilitative care? Rehabilitative care is for children who need long-term support due to disabilities, chronic illnesses, or recovery from major conditions. Key aspects of rehabilitative care. 1. Physical rehabilitation. Physiotherapy helps children with mobility issues regain strength. Example, a child with cerebral palsy uses assistive devices like braces or wheelchairs. 2. Cognitive and speech therapy. Therapy helps children with developmental delays catch up in areas like communication. Example, a child with delayed speech attends weekly sessions with a speech therapist. 3. Psychological support. Emotional well-being is prioritized for children coping with long-term conditions. Example, a child with cancer attends art therapy sessions to reduce stress. 4. Educational support. Schools and caregivers collaborate to ensure a child's learning continues. Example, a visually impaired child uses Braille materials to study effectively. Integration of goals. These goals often overlap in real-life pediatric care. Let's look at an example. A premature baby in the NICU, neonatal intensive care unit, promotive care, monitoring growth parameters daily, preventive care, administering vaccines and infection control measures, curative care, treating respiratory distress with oxygen therapy, rehabilitative care, starting physiotherapy for motor skill development. Conclusion. The goals of pediatrics ensure a holistic approach to child health care. By promoting health, preventing diseases, curing illnesses, and rehabilitating affected children, pediatricians and nurses play a pivotal role in shaping healthy future generations. Always remember, a child's care isn't just medical, it's about supporting their entire journey to adulthood with empathy, precision, and dedication. Let's now discuss examples or case studies where these goals are applied.